Vulval cancer is a cancer of the skin of the vulva. The vulva is the external part of the vagina, or often referred to as the lips. There are the larger lips and the smaller inner lips. Vulval cancer is rare, but we do see it in both a younger group of women and in an older group of women. In younger women, it does tend to be associated with the human papilloma virus and can present with itching or small lumpy areas which a woman may detect by herself. In older women, so women usually past the menopause, it more often than not arises where there has been a history of chronic itching in the area and an underlying skin condition which we know as lichen sclerosis. But there are other skin conditions that may cause it to happen also. Most women with vulval cancer do have symptoms, and the main one is vulval itch, often misdiagnosed as vulval thrush, which is a common condition as well. But importantly, any woman who has persistent itch of the vulval skin should insist on having an examination. I know this can be embarrassing, but it is something that can detect an abnormality very early and means that a cancer will never be allowed to develop if it is managed properly. The risk factors for vulval cancer include a history of HPV infection. So if a woman has had an abnormal cervical screening test or treatment for abnormal cells in the cervix, then she may be at higher risk of developing vulval cancer. Smoking is a risk factor for vulval cancer, and if there have been any vulval warts in the past, this is also a risk factor. In the older woman, it is a condition that causes chronic itch, and if the itch is not under control, then that's what can lead to the cancer. Once vulval cancer is diagnosed, it is recommended that a woman is looked after by a specialist gynecological oncologist. The treatment of vulval cancer more often than not involves surgery, which when you think of where this is located is very confronting because it can often lead to distortion of the vulva and those parts of a woman that you can see easily yourself. However, for most women, being able to be sexually active afterwards is still possible, and ongoing follow-up with a doctor and support is very important for ongoing surveillance.